Hey, what's up? Barnaby here. You were smart to check in with HelloLife.net because we're all about making sure that you have a great life. And you know, Dr. Chamberlain, he's a family medicine specialist. We've been getting a lot of emails recently, folks wondering, what is the difference between anxiety and anxiety disorders?
Well, that's a really good question. We all experience anxiety from time to time, and that's normal. Getting the butterflies in your stomach, you're going to do a speech, you're going to do something you don't normally do.
Sure.
And that's not a disorder, it's not a problem. But some people have anxiety symptoms that are either all the time or interfere with their life in a way that it's a real problem. It interferes with their life where it's not reasonable. Even the person themselves can recognize, well, this isn't normal, this isn't right. And that's really an anxiety disorder when that occurs.
Do a lot of people just think, well, maybe this will go away, and so they leave it untreated for a long, long time?
Yeah. A lot of people with anxiety really, or anxiety disorders, think it's normal at first, and usually it builds and builds to the point where they realize there's just something wrong here, and I need to do something about it.
Okay, and there's different types of anxiety disorder.
Yeah. There's really 5 categories of anxiety disorders. They've broken it down to generalized anxiety disorder, which is kind of a generalized angst, a generalized just not being anxious most of the time. There's obsessive compulsive disorder is actually a subset of anxiety. Post-traumatic stress syndrome is a subset of anxiety disorders. Social anxiety disorders, so being afraid of being out in public or being around people. And then also panic attacks is a form of anxiety disorder also.
Yeah, and so what do we do about this sort of thing? I mean, do we go to somebody specific for diagnosis? Is it a psychologist?
Well, there's a lot of things people can do. There's things that they can do at home. There's books that help out with anxiety. There's different types of medical professionals. There's psychologists who can help with therapy. There's psychiatrists with medications. There's their normal family doctor or their normal primary care physician is a good sounding board to get things figured out and to start working on things.
It's interesting, though, because if you are suffering from this, then maybe you're not thinking clearly enough to take the step to go see a doctor. And so do you find that to be common, that people are just absolutely resistant, saying, you know what, this to me would make me seem like I am quote-unquote crazy, so I don't want to go there. I'm not going to find out more about it because I don't want to be that.
Yeah, I've had a lot of people where they don't want to get help because they feel like they don't want to be labeled as something. A lot of people, since they've experienced it for so long, they think it's normal for them. Well, I'm just this way, I can never be different. Other people might be different, but I can never be different. And they don't realize that, well, there can be changes and they can be different.
Yeah, and it is hard to stand by and watch if you're the spouse or loved one of a person suffering from one of these anxiety disorders. Any advice to the people that are on the sidelines watching a loved one kind of spiral out of control, how to intervene? Is there a forcible way to do it if it comes to that?
Usually forceful ways don't work well. Sometimes family members say, well, I just want to tell them to snap out of it, and that's usually not very helpful. But encouraging them to look in for ideas for help would be a good way. So being more encouraging to get help versus telling them just suck it up or just stop it.
Yeah, that never works,
does
it?
Work,
no, it's like telling somebody that has a weight issue to say, just eat less,
Yeah.
exercise more. So it is a troubling circumstance to have an anxiety disorder, and we have to be sympathetic to it and take steps possibly to help that person to a better reality.
Exactly.
Yeah. And you know what? That's what you're going to find right here. Little tidbits of advice about things that are affecting you, because this is, after all, a smart living network that you're looking at right here. It is HelloLife.net.